You might be wondering if treatment for obsessive compulsive disorder actually works or what it even looks like. Well, on today's episode, we're going to talk about that. Hi, I'm Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. Welcome to the Get to Know OCD podcast, where we talk about obsessive compulsive disorder, new advances in the treatment of OCD, and sometimes we even interview people who have OCD as well too and talk about what it's like for them to live with OCD and how they've moved through life with the challenges that OCD throws at them. In today's episode, I'm excited to talk to you about how we treat obsessive compulsive disorder. The gold standard of treatment for obsessive compulsive disorder is something called exposure and response prevention therapy. It's really two things that we do. Number one, we purposely want to expose people to things that are uncomfortable. These are the obsessions that they have. And obsessions are intrusive thoughts, images, and urges that people experience. And they might say that they're inappropriate to them or they're unwanted and they're intrusive and they just lead to a lot of discomfort. And so they attempt to neutralize them with some other thought or action. That's what a compulsion is. So in ERP, or exposure and response prevention therapy, we're purposely exposing people to those obsessions and we're asking them to not do a compulsion. What is a compulsion? Again, that mental or behavioral act. That's the thing that we need to prevent because it turns out it's the compulsions that are actually maintaining obsessive compulsive disorder. That's why the therapy is called response prevention, because we're trying to prevent a typical response. And what is the typical response in OCD? The compulsion. By eliminating the compulsion, we allow people to learn that they can handle whatever their intrusive thoughts or images or urges are. I'd contend that every single person in the entire world has intrusive thoughts or images or urges. None of us are able to go through life without having at least one of them. But just because we have them doesn't mean that they're bad or that we're even bad people for having experienced them. They're just part of being human. It's just the nature of the beast in some ways. For most people, they can just dismiss those and say, well, that was weird, or why did I have that? I wonder where that came from. But for people with OCD, they read into it more. They wonder what it meant, why they had it. Did they want it? If they wanted it, does that mean that they're a bad person for having wanted something like that? Should they neutralize it? Should they make sure that it doesn't actually happen? Because if they don't and it does happen, is it their fault? And are they really, really bad people? So we design this in a hierarchy. We start with a lower level of ERP work and we build up to doing more and more difficult things. This is not throw you in the deep end of the water for you to figure out how to swim. This is stick a toe in the water, see how it feels, and go from there. We are not here to scare you away from therapy. We want you to face your fears and learn that you can handle them slowly and gradually, building up confidence over time in your own ability to handle whatever it is that OCD might throw at you. No one with OCD has actually, by any kind of intrusive thought or image or urge, been harmed because of that. The harm comes from doing the compulsions. And the harm is things like relationships that have been lost because of OCD, jobs that have been lost, school that is not gone to anymore, people turning to drugs and alcohol, and unfortunately, even some people contemplating or even completing suicide. There is help available. And I'm hopeful that by the end of today, you recognize that and realize that you can get help. In fact, you could start that at nocd.com if you're interested, where we have care team members available to be able to meet with you and do a free chat with you and talk to you about how one of our licensed therapists might be able to assist you. Sometimes we need more than ERP work, and that might bring in medications as well. Typically, people start with the SSRIs or the SNRI medications. These are serotonin selective or other types of neurotransmitter selective medications where it blocks some of the reuptake of it. Basically, it keeps more of that, uh, shall we say, neurotransmitter in the synapse of the neuron itself, which means that it has more chance to bind with the next neuron, creating more action potentials, more excitement in the brain, and therefore more messaging that we would want to have. If those medications don't work, it could be because you're not seeing a specialist. Specialists will prescribe these medications at the level that they need to be, but people who are not as familiar with OCD might only go to a certain level. And this could be a problem because OCD dosages are typically higher than the typical antidepressant dosages. These drugs are typically referred to as antidepressants, but they work on things more than just depression. If those drugs after the right dosage don't work, then there's a couple of other options. One would be a tricyclic antidepressant called clomipramine, which has very good results for OCD, but more side effects due to the fact that it hits several neurotransmitters at the same time. Or sometimes there's even augmentation of these medications with a low dose atypical antipsychotic. Now, this is the new generation antipsychotics, not the old generation ones that caused tons of side effects and had lots of problems associated with them. And the dosage is usually very low. Sometimes with a low insight OCD or a near delusional level of insighted OCD, we really buy into the OCD and just believe it to be true. And sometimes a low dose of these medications can just allow for people to crack that door open just enough to allow for the therapist to get in and start to do the work that they need to do. For people who need more than that, there's higher levels of care for treatment. There's intensive outpatient programs or IOP. There's partial hospital programs or PHPs, and there's even residential treatment centers. And for people who want things on a different side of this, there's deep TMS, which is a transcranial magnetic stimulation that you can have done to your brain, where it will use magnetic pulses to help make some changes that are going on in the brain. There's a stereotactic radiosurgery, which is a bloodless surgery that uses gamma radiation to literally burn a small hole inside of the brain on either side of the brain to kind of destroy some of the pathways in the brain that OCD utilizes. And there's even something called DBS or deep brain stimulation, where you can insert leads into the brain and you can create an electrical field in the brain with these leads that competes with the brain electrical field that it normally has. I describe it like this. Imagine you're driving on a highway and you're listening to an AM radio, if anyone does that anymore, and you're going underneath those high tension power lines. And when you do that, you get that fuzziness as you go under those power lines. It's because the electrical field of the power lines is interfering with the AM radio frequencies. Imagine being able to put some leads into your brain that could create something similar to that, an electrical field that is interfering with your brain's own electrical field. I say all of this for you to recognize that there's lots of things that are available to you. And there's even new treatments that are being studied and evaluated now for obsessive compulsive disorder as well too. Some people are working on therapies for all of OCD, and some are even focusing on some specific subtypes to develop specific treatments for that as well too. More will come out on that as we see more publications and we see more things getting peer reviewed and published in journals as well. I'm excited to see where the field goes. For now, we know that ERP plus or alone with medication can be the most helpful thing available to you. If you're interested in getting exposure and response prevention therapy, well, got a solution for you. Check us out at NOCD.com, where we have licensed therapists available who are trained in exposure and response prevention therapy for obsessive compulsive disorder. Our care team will meet with you and help you find a licensed therapist in your area who can work with you and even hopefully take your insurance as well too. So I hope that this has been helpful to you. These are some of the basic things you can know about treatment. And here is one piece to leave you with too. We know that treatment is effective and it works. There are thousands and thousands and thousands of people who have gone through treatment for OCD who are living the lives that they want to live and not the life that OCD wants them to live anymore. Come on over to the NoCD.com area, check us out, meet with our care team. And if you like the information that we went over today, subscribe to this podcast, the Get to Know OCD podcast. We'd love to see you back again, where we'll share more information with you about OCD. Also, check out the NoCD YouTube page as well, too. Every Wednesday night, I do a live webinar where I answer questions from all over the world. Maybe you'll find some information on there from previous episodes that are helpful to you and answer some of the questions you might have about OCD, or join for one of the lives and throw some questions in the chat as well too. I try to get to as many as I can. Thanks for joining today and hope to see you back again soon.